Sweeney, who is a professor of government and technology in residence at Harvard University. She's the editor-in-chief of Technology Science and the director of the Data Privacy Lab, all at Harvard University. And if that doesn't keep her busy enough, I happen to know she's also the residential dean of Courier House, which is another big job. LaTanya has spent some time in government a few years ago working as the Chief Technology Officer at the FTC, and until very recently, she was a commissioner on the Commission on Evidence-Based Policymaking, which is where I had the great pleasure of working closely with her for about a year and a half. She has her own personal mission statement, which I think is very cool, so I'm just going to tell you what it is. Her mission is to create and use technology to assess and solve societal, political, and governance problems, and to teach others how to do the same. As such, I have found her to be a rare balance of principled yet pragmatic, authoritative yet very nurturing, and nuanced yet pithy, and I know you will find her talk very insightful. When LaTanya is finished, she's here in person. John Aboud is going to be our discussant. He is coming in through WebEx. I'll let him just pick up when she's finished. And John is at the Census Bureau. He joined the Bureau in 2016 as Associate Director for Research and Methodology and Chief Scientist. Among other important centers that in his purview, he leads the work of the Center for Disclosure Avoidance Research. And that center's work relates to John's passion for working on innovative solutions that balance both analytical confidentiality and disclosure avoidance, which is a passion perhaps first ignited in the 90s during his pioneering work establishing the Longitudinal Employer Household Dynamics Program at Census, where he was working under a special arrangement from his home institution. And when he's not busy at Census, John has a position at Cornell University, where he's been a professor, a principal investigator for Cornell's node in the NSF Census Research Network, and a co-principal investigator of the NCRN Coordinating Office. So with that, I'm going to turn it over to LaTanya, who's way down there.
Well, it's absolutely great to be here. They told me I have to stay still because of all these microphones. So if I drift off, I'm sure Bill will give me a pointer to tell me to go back. I just want to make sure I also stay on time. So it's great to be here. Thank you very much, Shelley. And also Catherine is here or was here. The Commission on Evidence-Based Policymaking was really a fantastic experience. I had been on federal committees before, and had, after the last one, the HIT Policy Committee, I was like, I'm never doing this again, ever. And so I was very reluctant, but it turned out to be a fantastic experience. And I'm really glad that it also led me here today. Now, as soon as I know how to use the computer, there we go. It's kind of ironic, too. One of the first names I saw on the program was Bill Winkler. And the reason that's ironic is 20 years ago, I was a graduate student, and I had done a re-identification experiment, and that experiment I got an email from this man from the Census Bureau who asked me to come to the statistics meeting and talk about it, and that was 20 years ago. And in some ways, this talk is very much about that 20-year span. So the talk itself is about the elusive sweet spot of privacy and utility, and in some ways, the talk picks up from the conversation 20 years ago, this idea that privacy is always put against utility. And so we ask ourselves, what we mean by privacy is what privacy guarantees will that data set make? And by utility, what good is the data set? What is it good for? At the extremes, the answer is really easy. We can always guarantee privacy by just making up stuff. We just randomly put in values, and we can guarantee privacy. And we can always guarantee utility by giving up the rawest, clean version of the data set possible. So clearly what we really are looking for is how do these two pit against one another? How does that play out, and how do we think about it? Historically, for most of the 20 years, and maybe even for some of you still today, it's kind of this traditional belief that you have to trade one against the other. That, you know, there's a lot of fighting that happens along this curve that says, well, if you want more privacy, we're going to give up some utility, and if I want more utility, I've got to give up some privacy. And that's been pretty much the traditional belief system. But the sweet spots, the spots where we consider it a true success, is not kind of finding a path on a kind of minimal curve, but finding a path on a maximal curve, turning it around to say, what is the most privacy and utility I can provide? And that requires a bit of a rethinking to the way we've been doing it. And some of that rethinking we see over the last 20 years, but we're not quite there yet. So let's see, let me give a sense more of where we are by giving some examples of things that aren't working and also things that might push us up towards the blue. One of the things that has guided a lot of the discussion over the last 20 years, and certainly throughout the 1990s and early 2000s, has been this kind of ongoing argument of who can be re-identified, a sort of an extreme position that Paul Ohm writes. He says everyone can be re-identified in data. Jane Yakowitz writes no one can be re-identified, and they get into this kind of back and forth discussion with no scientific proof really on one side or the other, using scientific evidence as is anecdotally provided, but sort of leaving us in this quandary. And that's pretty much how the battle along the traditional belief system of privacy and utility for the most of these 2 decades has played out. Who made the most convincing argument, or who had the most pain? And the pain points are primarily on the utility side. You hardly really have to worry as much on the utility as you do on the privacy. And the reason is it's usually utility that is requesting. Privacy doesn't say, please give out a data set. There's always a purpose for which usually the data set's trying to be given, and that tends to tell us what the utility is. What does this data have to continue to be good for? And then the question is, what privacy guarantees can we make? So when the year was 1997, I was building my thinking machine. I was a computer science student at MIT when an ethicist walks in one day and tells me how she hates computers. I, who had a love and passion for technology, believed it could solve all things, stopped what I was doing, had to have an immediate conversation to correct her thinking. And she foretold, really, the world that we see today, a world where data sharing was rampant, the idea that data given for one purpose would be repurposed and used for many others. And the example that she gave was health data. And what really had her really riled up was this particular health data set that had come from the Group Insurance Commission in Massachusetts. This is the group that insures state employees and their families. And she said, you know, what about this data? So we're getting back and forth, and I'm talking about all the benefits that technology will bring and lives it might save, and she's making this argument. And so I wanted to disprove her. And so the data set that had been released had the fields that you see on the left. It had diagnosis, procedures, a visit date, and also demographics. Zip code, birth date, and gender. Didn't have the individual's name or social security number or anything like that. And William Weld was the governor of Massachusetts. He had collapsed. He was in that data. And so the question was, could I re-identify him? Could I prove a point to her that she was wrong, that the data was clearly anonymous? That was the best practice of the time. I'm sure it was fine. And so the first thing I did was do a back-of-the-envelope calculation. I said, look, there are 365 days in the year. There are 2 genders, and there are roughly, and people, let's say, live 100 years. And then, of course, that's 76,000 combinations, and we looked it up, and the typical zip code had 32,000 people. So my proof for that didn't go so well. So then I said, well, I'm sure it's okay because this is how it's given out. And I said, let me see what I can find out about William Weld. So William Weld lived in Cambridge, so I bought the Cambridge voter list for $20. It came on 5¼ inch floppy drives. Shelley told you that I'm the faculty dean at Currier House, which means I live with 450 Harvard undergrad students. And if I say floppy drive, many of them will start scratching their head, but some of us still remember what a 5¼ inch floppy meant. Anyway, it had voter data, but it also had demographics. And the information about William Weld was well known. And there were 6 people who had his date of birth. Only 3 of them were men, and he was the only one in that 5-digit zip code. So with those same demographics, instead of showing her how she was wrong, I actually ended up proving that the practice was wrong. And that led me to meet Bill Winkler 20 years ago. When we generalized that by looking at the 1990 census data, it turns out that around 87% of, using our model, 87% of the people in the United States were unique by date of birth, gender, and zip code. But as you generalize from date of birth to year of birth, from 5-digit zip code up to county, you can see the percentages of how many people are unique drops. Notice it never really goes to zero. There are people who, if you only know the county in which they live and their year of birth and gender, were still somewhat unique, and but they tended to live in Yellowstone, park rangers and places like that. But still, it was pretty interesting. That work had a profound effect on that practice. It happened at exactly the time the HIPAA privacy rule was being debated in Congress. So the work is actually cited in the preamble, and that had a ripple effect around the world in Australia, Canada, and other countries sort of following suit. So that simple experiment had a really big impact. The importance of that experiment, though, is beyond that simple example. The role of re-identification reminds me a lot of encryption in computer science. Many years ago, or many decades ago, when we wanted to encrypt data, computer scientists would just make up some idea. They would just come up with some random way that you would encrypt data. And then someone would break it, and then someone would come up with smarter ideas about how to encrypt it based on what was broken. And then someone would use it, and we were using it for all kinds of sensitive information, and somebody else would break it. And it kept getting better and better until we got the hard encryption that we enjoy today through RSA and the little lock on our browser and so forth. That is, we can tell you exactly how your data is encrypted, and without a tremendous amount of computational power, perhaps more than you could ever muster, we can make some assurances about your inability to get it. That's exactly the kind of loop that re-identification should have been on. So in other words, here was this disruptive experiment from the Weld example, and it in fact had an impact. It showed a vulnerability. We improved our policies and our methods, and the cycle needs to continue. And if the cycle does continue, where would we be? Well, when do we get to hard privacy? But this talk is really an assessment as to how well we're doing with this cycling, if we're making the cycle at all, or to what extent is it broken. So far in the talk, I think I've made the case a bit that re-identification can stimulate improvement. So what I want to do for the bulk of the rest of the talk is I'm going to talk about recent re-identification experiments that have happened from 2013 till last month, right? And look at to give us a sense of the state of privacy vulnerability today. So this particular re-identification experiment comes from us through hospital discharge data. I don't know how many of you are aware of that, but basically all 50 states collect information about your visit to the hospital or a physician's office. 33 of those states sell or share that data, but only 3 of them use a standard as strong as HIPAA dictated. And they're exempt from HIPAA because they're a state collection, and so therefore they don't have to adhere to HIPAA. And so the question here is, are the states in making their decisions, are they doing better? Is HIPAA is the HIPAA safe harbor messing up the data more than it should, and therefore we should lower that bar? Or is it that the states are putting so much more data at risk? So for $50, we purchased the data for that year from the state of Washington. It came with millions of records, and this is a sample of the kind of records kind of information found in that records: hospital codes, diagnosis codes, procedure codes, some demographics, and so forth. You can see that it does not adhere. It doesn't adhere to HIPAA because one of the demographics includes all 5 digits, for example, of the zip code. But for our experiment, we want to know how many of these people could be re-identified. So we went to and there had been some anecdotal reports in the New England Journal of Medicine many years ago that hospitals and banks and so forth were re-identifying this kind of information and tweaking creditworthiness based on medical condition. So the kind of thing that a hospital would know about you or an employer would know is the same kind of thing you would find in these kinds of blotter stories, who had to go to the doctor's office or who went to the hospital and so forth from a stabbing or an automobile accident or something like that. So we just simply went to the Harvard Library. They had particular journals, newspapers that they had archived from Washington State. We used those, and then we just simply did a simple matching. That is,
taking the information out of the articles and just doing a straight matching, not statistical matching, just a direct matching, a one-to-one correspondence, and how many of them were unique. So that is, that it matched, and it matched on only one person. And we found that almost half, or 43% of the 81 samples, were re-identified in this manner. They included professional athletes, congressional members, and so forth. This particular story of the guy on the motorcycle, it turns out that he actually was diabetic and had gone into a diabetic coma from the accident. Now, how do I know this? Because we gave all of the re-identifications to Jordan Robertson, who is a reporter for Bloomberg News, and under a special agreement, he actually contacted each and every one of those people and was able to confirm that they were all correct. So after the Weld experiment, what do we expect? We expect now, today, that was 2013, we expect today that, in fact, more of the states would have corrected. But it didn't happen. Only 2 of the states changed. Washington State changed. It changed its law and then changed its data set so that it gave a more anonymous version for public use. And then if you needed the more sensitive version, you had to go through an application process and a higher process to get the access to more sensitive data. California changed its process, and that was it. So how do we get the rest of them to move? How do we make that loop really happen in the hospital discharge data? So we decided we have to go state by state. So a couple of months ago, we just finished with Maine and Vermont, and that will be coming out very shortly. And we're also able to show that roughly 30% of those were also re-identified. All right, and see now if the dominoes will fall and we can improve that grade. So what does those examples of hospital discharge data show us? They say that 20 years later, privacy vulnerabilities still exist. Now, what about this HIPAA safe harbor? What about states that adhere to the HIPAA safe harbor, or what about other data sets that adhere to the HIPAA safe harbor? I think everyone in the room is probably already aware of how it works. It's sort of a prescription of what you do to the data, that if you remove all the explicit identifiers and you make all the dates only years and you redact the zip codes to the first 2 digits or to no digits, then you can share the data widely. It applies to some forms of medical data. If we were to do that back on the kind of data that we're looking back at back to the Weld experiment, we find that it comes out to about, in that data set, it would have been about 0.04%. That is, the park rangers and a few people in remote areas, or highly unusual, would in fact be unique. Another study was done that found a number 0.22%. And that study looked at the demographics of around 15,000 Hispanics in 2 data sets and found how unique the matches were. So, and that was a study by Lafke, Kwok and Lafke. And so how many identifications? Ohm still says everyone. They say less than 1%. He says you're wrong. And Elamon and others wrote a paper that says, no, actually they're right. The HIPAA safe harbor is a great standard. Everyone should use it. So we wanted to test this. So we went, and one of the biggest problems that we see in these kinds of studies, or in this argument here, is that it's kind of an overfit to exactly what I did at Weld. What I did in Weld was I used the demographic fields, date of birth, gender, and zip code. So what did the HIPAA safe harbor make sure it addressed? Date of birth, gender, and zip code, right? But what about the other fields? There are lots of other fields in the data, too. So we wanted to do a study that used other fields in comparable data to see how many people could be re-identified. So we looked at health, just because of opportunity, we looked at this particular study in a health environmental study, in which in 2006, Silent Spring Institute had surveyed households in California and households in Massachusetts, and around the correlation of risk factors related to outdoor air versus indoor air. And so the data said that they also had the demographics, gender, their process. They don't give out birth year, they do it in decades, and what year you moved in is in decades. They include race and ethnicity, and then they tell you something about the house.
the number of bedrooms, the number of bathrooms, the square footage, and the decade in which the house was built. We took that data set and we just had them instead of giving us birth decade, give us the year of birth. And let's see what we could do. We did both birth decade as well, but in the HIPAA world, we would just do the year of birth. Once we found these matches, we then go to people data, which is just data broker from data brokers, and we use the date of birth, move-in, race, ethnicity to infer, and we use race, ethnicity, and gender are inferred from the name, first name for gender using the census list, and last name to race, ethnicity, also using the census list. So that's sort of the two-phase experiment, and what we were able to do is in the version that had birth year, we were able to re-identify 25% of the participants by name. That is, in health data, if I use prescription data, diagnosis, and link it up to web visits, websites, and things like that, that's the equivalent of this. That is, I'm going to use other things that aren't necessarily demographics that still appear in the data to actually to help me re-identify the data set itself. So what do we learn from that? We learned that the 25% of people in the under HIPAA safe harbor, 25%, which is a long way from the less than 1% number, are still re-identified. So that doesn't sound like we're moving in the right direction. But what about expert determinations and best practices? So I had a fantastic opportunity 2 years ago. The work was actually done in 2016 to be a part of a lawsuit. So there was a public records request, or a FOIA request, as we might think of at the federal level, was made against the California Bar Association. And the data that was being asked for was for every person in the last 4 decades or so who had ever taken the bar, whether they passed or didn't pass. They wanted the law school, the year they graduated, their LSAT score, their GPA, their race, and whether they passed or not. How many tries did they take? So what's interesting about this data set is that if you take an applicant to the bar who fails the bar gets their test score back, but an applicant who passes the bar never knows what they scored. And so that's to prevent things like a rating system. It's sort of, the MD system works the same way. It's to prevent this idea that you're a better lawyer or a better doctor because you scored higher on the bar. They just want to say, no, the bar is the threshold, and anybody, no matter how high you jump over that bar, you're still a lawyer. And no matter how high you jump over that bar, you're still a doctor. And so therefore, they don't release the scores. And then the scores could be used against people. So could GPAs and LSAT, because remember, many of these attorneys have now, some of them have matriculated to be partners in law firms, to hold political offices, to be judges, and so forth. Doesn't mean they were necessarily the best students in their class, and that could be quite embarrassing. So this was the concern in the data set. The other side went out and hired a group of experts that by all means are definitely among the country's leaders in redacting data. They've been responsible for some of our largest data sets that are currently made public. They've had years and years of experience of doing this. And so they submitted protocols and they submitted a version of the data that used their protocols that they asserted that were privacy protected to a particular degree and useful for the study. That is, that the person requesting the data to do a study, his original study, this is Richard Sander, and his study is the relationship between race and your ability to pass the bar. And so they said, well, it's still going to be useful for his study, but we're going to make some guarantees about their privacy. So what we did was we assumed that the experts were absolutely correct, that every protocol and data set they gave us is going to absolutely adhere to the standard they set, and it's going to be useful to the data. So if this data is perfect, then there are some re-identifications that shouldn't be possible. You know, there shouldn't be a certain number of re-identifications that shouldn't be possible if they're saying it adhere to the HIPAA percentage. There are certain kinds of re-identifications that shouldn't be possible if they were making claims about limitations on harms. And so we call this a kind of null hypothesis test. And the testing we did, first of all, was we said, first of all, is the protocol itself technically unreasonable? Now, this particular test one is an interesting nuance that we'll revisit in a minute with differential privacy. The nuance of technically unreasonable is what demand can you make on a state agency or on a governmental agency under a public records request that says you produce me a set of data that adheres to some computation, some computational standard, and they can, they're not required to go out and just produce this on their own. And so the first question is it technically reasonable? The second test is, okay, if it's technically feasible for the agency to produce it, are re-identifications practical? And if re-identification is practical, are they likely to be small groups, less than 21? In the law, it has to do with defamation. So group 21 or less often becomes our target. In the health space, a lot of times we talk about how many are unique, but also, so from 1 to 21 is what we refer to as small group matches. And if the matches were made, would they be harmful? Is there some harm that could come from having re-identified that person's record? And if the answer to all of those questions are no, except for the technically, if the answer to all the questions are no, then there's no objection. They should get the protocol is fine, and that version of the data set for that protocol should be released. So the 4 protocols that they use, one they called 11 anonymity, named a bit after K-anonymity, and for those of you who know K-anonymity, I'll tell you why it's not. But basically it had a lot of recodings and aggregations, and some of the subsets of variables had 11 copies or more of them. It failed, and we had re-identification. We demonstrated correct re-identifications. They had 11 anonymity plus, where they took the same 11 anonymity, and then they took away some of the digits off the GPA, and they just randomly dropped 1/4 of the records. It failed. We still had re-identifications. Then they said, well, what about an enclave? They've been quite aware and participated in the census research enclaves, so they provided a version of that. It failed. It still had re-identifications. Then they had the idea of, well, let's just replace everything pretty much with standardized score. Every person is going to be replaced with their standardized Z-score for each of the fields that were appropriate. It also failed. Re-identification. It also failed both on re-identification, but it also failed the effort and know-how, whether or not the agency would have it. So let me give you a sense. We don't have time, and I'm sure you probably don't really care about the details of all their protocol. It's 14 steps, but I want to give you a sense that it wasn't arbitrary. It really was very detailed and very well thought through. So they recoded, they cleaned up the data in the first 2 steps, and then in the 3rd step, they began aggregating things into like graduation year ranges, recoding variables by law school class. So applicants from schools that, like the University of New Orleans, would have a bigger year gap than, say, what they call a Class 1 school. And then they did all this LSAT recoding into quintiles and so forth. And then they computed cell counts, and they redacted the race variables accordingly as well. And they wanted to keep blacks and Hispanics isolated, so whenever they needed to, they would combine Asians and whites together. And so they just do this, they do all of this recoding around race. And so this is an example of what the data, a version of what the data would look like. So for a school like Whittier, we see the person's actual LSAT and GPA and their race, and Hispanic and other, we know that they're not white if they're other, and so forth. If we look at the identifiability of that data set, that is how many records are unique, that would be identifiability of 1. How many records are there 2 records like it? That would be a 2, and this is cumulative. And one of the things that really jumps out at you is that the very data that they're isolating, i.e. the blacks and Hispanics, is the most identifiable data. Because of the redactions they did, they wanted to preserve these outliers. It's only less than 3% of the entire number of applicants to the bar were black or Hispanic. So it's a very tiny percentage, and they're trying to keep that intact. And so as a result, they're leaving them quite exposed as they're making whites far far less identifiable. They also just totally didn't understand the kind of data that's out there. There are graduation programs. The State Bar itself lists everyone who is an attorney and where they went to school. People publish their GPAs on LinkedIn resumes, and they published LSATs on LinkedIn resumes. There are photos of graduation classes for which we could also infer race. There are graduate school club memberships that were online historically as well. And so we end up with this grid where the fields are the rows and the columns are the kinds of data that could be used to re-identify. And we just drew lots of different paths through here as to, well, we could do this, this, and this, and look who we get. We could do this, this, and that, and look who we get. So there was no shortage. But what that study really tells us is that our best practices in the field have privacy vulnerabilities. What about these formal protection models, k-anonymity, differential privacy, synthetic data? So k-anonymity totally screws up your utility. If you were to k-anonymize across all the data in the law school data set, they said that would totally ruin it for them because they wouldn't have those isolated Black and Hispanic records. Differential privacy and synthetic data don't qualify for public records. Public records has to be truthful to the original data, not truthful to the original statistics of the data, which is really interesting as well. But formal protection models can definitely work in other settings under other conditions. The thing that limits them, though, is they're not necessarily useful for all purposes. And once I let out one data set under one of these models, say as a public use file, I still need, sort of like the Washington model, what to do with the others. So I want to end then with some work that the Commission did in their report about what could be done. And what the Commission says is, well, you know what you could do is you could do a risk assessment on your data, figure out and have scaling access. So think about that Washington State model where their response was to have a public use file that they could make some guarantees about, and as they knew the risk was higher, the access to the other data sets required more. And also what's nice about this is that the process itself becomes transparent. One of the places and ways that that's been used is heavily NSF-funded a research project called Privacy Tools at Harvard. One of our projects from that was the data tag system, which uses this model after it's used at Harvard, where we basically assign these graduated scales of accountability. That is, data that's blue is public, green is public, but we have a way to let you know we found some risk with it or something like that, then you agree you'll stop using it, and it goes all the way up. And with that, we can assign security features and access requirements. And so the idea of being able to say, if I had a differentially private data, it's clearly in the blue. If I had k-anonymity, it would clearly be in the green. But, you know, I might take a data set that's quite sensitive, might be red or even crimson, but I could make a differentially private version. So what's nice about this is all of a sudden, in this kind of multi-level repository model, we end up with the idea of actually giving out far more data than we thought before, because now we can give out data, we can make a version that's blue or green, and it doesn't have to satisfy all requirements. We just modify the access requirements to it. So I'm going to stop there and say that on the one hand, it's a depressing story over the 20 years. Bill will now have that same look he had 20 years ago. He says, I remember that same annoying kind of talk. And it is a little depressing, but on the other hand, it's also, we see progress. We have better tools, but then those tools are not panaceas. They're not the answer to all of our questions. And so we're still having to merge policy with the technology of our time. Thank you. I should go over here. Thank you for John. Yeah.
Mute off.
We're ready for John. I believe Wendy said John does not have